Hello, and welcome to this week's episode of Medisodes. This week we're going to be discussing dengue. Dengue is a mosquito-borne viral infection, found most commonly in tropical urban environments. The virus responsible for causing dengue is simple, called dengue virus, and there are 4 currently identified dengue virus serotypes, also known as variants, which means that it's possible to get infected 4 separate times. While many dengue virus infections produce only mild illness, severe illness causes acute flu-like symptoms. This can occasionally develop into potentially lethal complications, called severe dengue. The symptoms of dengue span a wide spectrum. This ranges from subclinical, where people do not even know that they have been infected, to severe flu-like symptoms that pose a threat to the infected person's life. Although less common, some develop severe dengue, which can cause any number of complications associated with severe bleeding, organ impairment, or plasma leakage. Severe dengue has a higher risk of death when not managed properly. Unfortunately, dengue is most common in less developed countries, where healthcare systems are neither developed or as comprehensive as those in more developed countries. Multiple infections from various serotypes is believed to increase the risk of developing severe dengue. Statistically, dengue infects an estimated 390 million people per year, of which 96 million manifest clinically. Over the last 2 decades, the number of dengue cases reported to the WHO has increased 8-fold, from about 500,000 in 2000 to 5.2 million in 2019. The number of reported cases is significantly lower than the number of cases reported to the WHO, because several cases are asymptomatic and or not officially reported. Despite the risk of infection existing in 129 countries, 70% of this burden is in Asia. By 1979, only 9 countries had experienced severe dengue epidemics. A shocking figure considering that the disease is now endemic, meaning local to, more than 100 countries across the globe. The Americas, Southeast Asia, and Western Pacific regions are the most seriously affected. COVID-19 is increasing the pressure on healthcare and management systems around the world, and this has meant that countries have less funds to invest in the treatment and management of dengue. The combined impact of COVID-19 and dengue epidemics potentially results in devastating consequences. In more detail, dengue should be suspected when a high fever, so 40 degrees, is accompanied by at least 2 of a severe headache, pain behind the eyes, muscle and joint pain, nausea, vomiting, swollen glands, and rashes. A patient enters what is called the critical phase normally about 3 to 7 days after the onset of illness, and it is at this point that symptoms of severe dengue can manifest. Warning signs of this can include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, and restlessness. Now that we have a general overview of dengue, what it is, its symptoms, and the scale of the disease, I'll hand over to Shrey, who will be talking about how dengue is transmitted and how it causes disease.
So, like many other tropical diseases, such as malaria, check out our episode on that, dengue is spread by mosquitoes as a vector. Fortunately, in the UK, mosquitoes do not carry the dengue virus, but in many other countries, particularly in Southeast Asia, the Caribbean, the Indian subcontinent, South and Central America, Africa, and the Pacific Islands, mosquitoes do carry this virus, and there is information about fit for travel when you're going to these countries. So if we look at what type of mosquito is infecting, it's usually female mosquitoes, and the 2 main species are Aedes aegypti, which has distinctive white stripes on its legs, and there's also Aedes albopicus, which is lesser but still a high risk. There also is local risk based on rainfall, temperature, humidity, unplanned rapid urbanization, which is common in places such as Asia. The mosquitoes tend to bite in the early morning or in the early evening just before dusk. They like still water in built-up places such as wells, water storage tanks, and old car tires. If we look at how the dengue virus is specifically transmitted, mosquitoes feed on an infected human, and the virus replicates itself in the midgut of the mosquito. The virus then spreads to the secondary tissues of the mosquito, such as the salivary glands. The time between ingestion and transmission to the next host, known as extrinsic incubation period, take between 8 to 12 days at a temperature of 25 to 28 degrees. And this is why dengue is not that common in the UK, because it's quite a high temperature. But this extrinsic incubation period is affected by the magnitude of temperature fluctuations, the virus genotypes, the viral load. Once a mosquito has been infected, it can transmit the dengue virus for life. The average lifespan of these mosquitoes is about 3 weeks. It's important to note, though, that the dengue virus normally cannot be spread from a person to a person. The only exception to this is perhaps vertical transmission. A pregnant mother who is infected with dengue, giving it to their unborn baby. However, cases of this are low, and it's definitely linked to the stage of pregnancy. But however, mothers who have the dengue virus are more likely to have preterm birth, low birth weight, higher risk of fetal distress. So now we've talked about how dengue is spread. Now let's look at ways to prevent it.
Preventing the transmission of dengue is essential to maintain good public health. Avoiding infection of dengue mainly involves preventing mosquito bites. Mosquitoes that spread dengue virus bite during the day and night. There are a number of ways that people can reduce the risk of mosquito bites. Firstly, the use of EPA-registered insect repellents, with one of the active ingredients shown in the table on the slide, can greatly reduce the chances of being bitten by mosquitoes. When used as directed, EPA-registered insect repellents are proven safe and effective, even for pregnant and breastfeeding women. It is important to make sure that the insect repellent used is EPA registered because the effectiveness of non-EPA registered insect repellents are not known. It is also essential that insect repellents should not be sprayed on the skin under clothing. If you're also using sunscreen, apply sunscreen first and insect repellent second. Wearing clothing that covers the arms and legs can also be another effective method of preventing mosquito bites, especially for children. As an additional layer of protection, clothing, boots, and other items should be treated with permethrin. Permethrin cream contains an insecticide which kills insects and so can be an effective mosquito repellent. The advantage of using permethrin-treated clothing is that they will protect a person even after the treated clothes have been washed multiple times. Note that permethrin products should not be used directly on the skin. The use of screens on windows and doors can help keep mosquitoes out of the house. Mosquitoes can even get through small holes in these screens, so any holes in these screens should be repaired as soon as possible. Air conditioning can also help to keep mosquitoes out. The use of mosquito bed nets is also quite common in many countries, as they provide a cheap method of preventing mosquito bites at night. They are commonly used when sleeping outside, where an individual is at a higher risk of mosquito bites. One thing to bear in mind is that mosquitoes breed near standing water. Therefore, regularly emptying buckets, bird baths, trash containers, and anything that can hold water is important to limit the spread of dengue. Vaccines are the most commonly used prevention methods for public health diseases. A vaccine to prevent dengue, called Dengvaxia, is licensed and available in some countries for people aged 9 to 45 years. The World Health Organization recommends that the vaccine only be given to persons with confirmed previous dengue virus infection. The vaccine manufacturer announced in 2017 that people who receive the vaccine and have not been previously infected with the dengue virus may be at risk of developing severe dengue if they get dengue after being vaccinated. In May 2019, Dengvaxia was approved by the US Food and Drug Administration for use in children aged 9 to 16 years, with laboratory confirmed previous dengue virus infection and living in an area where dengue is endemic. Dengvaxia is not approved for use in US travelers who are visiting but not living in an area where dengue is endemic. In June 2021, The Advisory Committee on Immunization Practices recommended the use of dengue vaccine to prevent dengue in children aged 9 to 16 years with a laboratory confirmed previous dengue virus infection and living in an area where dengue is common. So hopefully you've gained a good insight into some of the ways that you can help to reduce the spread of dengue. Now on to Anupam, who will be talking about the management of dengue.
Dengue as a disease has no known cure or specific treatment. Instead, you can only relieve the symptoms until the infection has passed. While this might sound very dire, luckily, most people who do have dengue recover without any ongoing problems. The risk of death among those with severe dengue is only 0.8% to 2.5%, and with adequate treatment, this is less than 1%. However, it is noted that those who develop significantly low blood pressure may have a fatality rate of 26%. The risk of death among children less than 5 years old is 4 times greater than among those over the age of 10, and elderly people are also at higher risk of a poor outcome. However, for the majority of people who contract the disease, it is not life-threatening. You can usually look after yourself at home, and the following may help. First, fever reducers and painkillers can be taken to control the symptoms, such as muscle aches, pains, and fevers. Taking paracetamol or acetaminophen to relieve pain and fever is advised. However, NSAIDs, or non-steroidal anti-inflammatory drugs, such as ibuprofen or aspirin, must be avoided. These anti-inflammatory drugs act by thinning the blood, and in a disease with risk of hemorrhage, blood thinners may exacerbate the prognosis. Also make sure to drink plenty of fluids to prevent dehydration. However, if you are abroad when you contract this disease, drinking bottled water is advised, especially ones that are properly sealed, as in a lot of countries water standards are not that good. And finally, getting plenty of rest is important. You should start to feel better after about a week, although it may be a few weeks before you feel normal again. And getting medical advice is always advised. And if your symptoms don't improve, you should get to a hospital or care centre. For severe dengue, medical care by physicians and nurses experienced with the effects and progression of the disease can save lives, and it decreased mortality rates from more than 20% to less than 1%. Maintenance of the patient's body fluid is critical to severe dengue care, and therefore patients with severe dengue should seek medical advice upon the appearance of warning signs. Furthermore, fluids can be given intravenously to increase the chance of survival. But beyond that, dengue doesn't have any known treatments or cures. Thanks to vaccination programs worldwide, dengue has become less and less of a threat over time. However, there are still many people around the world who contract the disease. And to wrap it up, I'm going to pass back over to Adrian.
I hope we've gained a brief overview into dengue, its treatments, prevention methods, statistics, and how it's transmitted and how it causes disease. It kills millions of people and will do for the forthcoming future, so it's important that people are educated in ways to prevent themselves from getting the infection in the first place. Thank you for listening. Be sure to like, comment and subscribe, and I'll see you next week for another episode.